Madam Vice Chancellor, former Vice Chancellors, Pro-Vice Chancellor for Academic and Student Affairs, Registrar, Provost, Deans, Directors, Heads of Department, former officials of the University, our distinguished professor and lecturer for this evening, members of convocation, the clergy, Nananom, invited guests, our friends from the media, staff and students, distinguished ladies and gentlemen, good evening. I take it again, good evening. Thank you. The University of Ghana maintains and celebrates a culture of excellence as our work is deeply rooted in cutting-edge research in line with our second strategic priority, impactful research. Therefore, it gladdens our hearts to welcome you to the Great Hall of the University as we celebrate Professor Mathew Kwame Yamoah Kyei, Head of the Department of Surgery at the University of Ghana Medical School, College of Health Sciences, who shares insights from his cutting-edge research tonight. Prof. Kyei delivers the fourth in the series of inaugural lectures scheduled for the 2024-2025 academic year and addresses the topic, Naked but Not Ashamed. Naked but Not Ashamed, revealing the good outcomes in the management of genitourinary disorders. Please let's lend rapt attention as we listen to our distinguished lecturer this evening. For now, distinguished ladies and gentlemen, it's my pleasure to invite our registrar, Mrs. Emilia J. Mensah, to deliver welcome remarks and to introduce the chairperson for this evening's gathering. Please let's welcome our registrar.
Thank you very much, Director of Public Affairs, Vice Chancellor, Pro-Vice Chancellor, Provosts, current and past officials of the University of Ghana, members of convocation, students, distinguished ladies and gentlemen, a very good evening to you all. We welcome you all to the Great Hall, and we also acknowledge all of those joining us online. And we also extend a special welcome to Prof. Folashade Ogunshola, Vice Chancellor of the University of Lagos and a member of the University of Ghana Council. We are delighted that you are all able to join us for this evening's inaugural lecture to be delivered by Professor Mathew Yamoah Kyei of the Department of Surgery of the University of Ghana Medical School. Inaugural lectures are an essential component of the university's programs, and every academic who rises to the rank of professor in his or her career in the university is expected to deliver an inaugural lecture. This offers the university the opportunity to recognize and showcase the academic achievements of its faculty, and also enables professors to share their research with colleagues within and outside the university and to celebrate this important milestone with their family and friends. I'm pleased to introduce the chairperson for today's inaugural lecture. Our chairperson is the first female vice chancellor of the University of Ghana. She's a professor of linguistics, an experienced administrator, and has over 20 years experience working in the higher education sector. In the University of Ghana, she has previously served as the Pro-Vice Chancellor in charge of Academic and Student Affairs, the Foundation Dean of the School of Languages, and as the head of the Department of Linguistics. As Vice Chancellor, she's leading the university to adopt technology in all of its operations while keeping the university's people as the focus. She has received numerous awards for her work in education, female empowerment, and leadership, and is a member of many prestigious societies and organizations. She's a fellow of the Ghana Academy of Arts and Sciences, the founding president of the African Humanities Association, president of FILLM, and Vice Chair of the African Research Universities Alliance, ARUA. Ladies and gentlemen, please join me to welcome Professor Nanaba Pia-Amfo, Vice Chancellor of the University of Ghana and Chairperson for this evening's inaugural lecture.
Vice Chancellor of University of Lagos and Member of Council, University Council, Professor Folashade Ogunsola, Pro-Vice Chancellor for Academic and Student Affairs, Registrar, Provosts, Deans, Directors, Heads of Departments, our distinguished lecturer, Professor Mathew Kwame Yamoah Kyei, faculty, staff, and members of convocation, past and present senior officers of the university, alumni and students, family, friends, and associates of the lecturer, specially invited guests from the health sector, esteemed traditional rulers, eminent clergy, the media, invited guests, distinguished ladies and gentlemen. Good evening and a warm welcome to all our cherished audience who are both here in person and online. It is my singular honor to chair this evening's inaugural lecture on an intriguing topic, naked but not ashamed, revealing for good outcomes in the management of genitourinary disorders. This lecture, as we know, will be presented by Professor Mathew Kwame Yamoah Kyei, a professor of surgery and head of the Department of Surgery, University of Ghana Medical School, who has specialized in genitourinary surgery and is a consultant urologist at the Kolebu Teaching Hospital. Drawing from his rich experience of surgical practice for the past 25 years, and as a specialist in genitourinary surgery for 20 years, Professor Yamoah Kyei throws the spotlight on a very important but sensitive topic which is scarcely discussed, possibly due to our own cultural and religious reinforcements. The human body, as we know, has many parts, each with a unique function. The genitalia, describing the externally visible sex organ, is commonly referred to as private parts for a good reason. It is expected to be covered and exposed circumspectly only in situations when it is in use. There are, however, conditions under which this protocol has to be broken to allow for medical interventions. Indeed, as indicated in the abstract, exposure allows for the diagnosis of genitourinary disorders, including prostate cancer, urinary stones, and penile fracture. Professor Kyei is set to share with us in this evening's inaugural lecture highlights from observations from his many years of surgical practice and consultancy. He will also delve into interventions and care plans they have adopted in the management of genitourinary disorders. Most of his major research findings that have improved outcomes in genitourinary surgery and medicine will feature in this lecture. The lecture also discusses into details how the deployment of technology is allaying the fears of the population and encouraging them to reveal without shame, making genitourinary procedures pain-free, preventing infections in genitourinary procedures to avoid catastrophic outcomes, and what is accounting for the rising incidence of urinary stones. Distinguished ladies and gentlemen, I believe you are eager to hear more, and so permit me to attempt a brief profile of our distinguished lecturer, after which he will mount the podium to deliver the details of the lecture with us. Professor Mathew Kwame Yamoah Kyei is a professor of surgery, and he has specialized in genitourinary surgery at the Department of Surgery, University of Ghana Medical School. and he is a consultant genitourinary surgeon, what we ordinary people call urologist, at the Kolebu Teaching Hospital. He has been in surgical practice for the past 25 years and in genitourinary surgery as a specialty for 20 years. He is currently the head of the Department of Surgery, University of Ghana Medical School. Professor Mathew Yamoah Kyei attended Obuasi Secondary Technical School for his ordinary level certificate and Presbyterian Boys Secondary School for his A-level certificate, coming out as a third best student in West Africa in the West African Examination Council examinations in 1990, the same year I took my A-levels. Professor Mathew, I didn't come third. Professor Mathew Kyei has had his medical school education at the University of Ghana Medical School. He completed in 1998. Having been adjudged as one of the 5 best students in his class, he was offered a fully paid scholarship to Westminster Hospital in London for his medical elective, sponsored by the Valco Trust Fund. He was appointed a medical officer and later resident in surgery in 1999 and completed his fellowship in urology in April 2007 under the keen eyes of Professor Edward Donko Yeboah. He won the best research presented by a resident in surgery at the West African College of Surgeons Conference in 2006. He's remained very consistent. He was elected as a fellow of the Ghana College of Physicians and Surgeons in 2012. He practiced as a consultant urologist at the Kolebu Teaching Hospital, joining the University of Ghana in 2010. His professional experience includes a fellowship in uro-oncology at the Tygerberg Hospital at Stellenbosch University in Cape Town, and a clinical fellowship at the Sheba Medical Center in Israel. He enrolled and completed a 2-year postgraduate diploma in theology with the Maranatha University College, which is affiliated to the University of Cape Coast, and he obtained a certificate in health administration and management at GIMPA in 2018. You can say he's almost an all-rounder. Professor Mathew Yamoah Kyei is an accomplished urologist. While his expertise in the performance of radical prostatectomy for prostate cancer has been of benefit to many patients, he has also trained other urologists in this procedure. His expertise in this area, as well as other areas of urology, has resulted in him providing services in various hospitals across the country. His research areas include prostate diseases and renal diseases. He has, in addition, written and provided valuable clinical images of rare diseases in his field of study and discussed same extensively. These research and longitudinal follow-ups have led him to produce over 50 publications in the form of articles in scholarly journals, book chapters, peer-reviewed conference abstracts, technical reports, and support guidelines. He has peer-reviewed over 20 health-related journals. Professor Mathew Kyei has been involved in collaborative research. These include the Ghana Prostate Cancer Study, Men of African Descent and Carcinoma of the Prostate, and the International Consortium on Cancer Biomarkers for Early Detection Study. He's also supported the University of Health and Allied Sciences Department of Surgery in their research work. Professor Kyei was appointed a lecturer in the Department of Surgery, University of Ghana in 2010, and he has risen through the ranks to become professor. He lectures undergraduate students at the Department of Surgery on courses in surgery and urology. He also gives lectures and leads discussions in medical ethics as part of the introductory course to clinical medicine. He is involved in the teaching, training, and demonstration of surgical procedures and supervision of dissertations of residents in postgraduate specialist training in surgery and urology in the West African Postgraduate Medical College, College of Surgeons, and the Ghana College of Surgeons and Physicians. He has been a supervisor and co-supervisor of research work of postgraduate students at the School of Nursing and Midwifery here at the university as well. He's an examiner and assessor of theses at the membership and fellowship examinations in surgery and urology for the postgraduate medical colleges, and an external examiner for the School of Medicine of the University of Health and Allied Sciences. Professor Kyei has served on numerous boards and committees at the school and college levels. He's also served on the University of Ghana Academic Board and the Business and Executive Committee. He was chairman of an ad hoc committee set up to develop a medical referral policy for the University of Ghana Health Services. He was a board member of the Faculty of Surgery for the West African College of Surgeons and the Ghana College of Physicians and Surgeons, and remains a member of the Examinations Committee for the two colleges. At the Ghana Health Service, he served as a member of the committee that developed the National Strategy for Cancer Control in Ghana from 2012 to 2016. He helped with the revision of the Ghana National Guidelines for Human Organs, Tissues, Donations, and Transplantations, and the committee that developed standards for urologist clinics for the Health Facilities Regulatory Agency in 2021. He is currently involved in the review of the Ghana Treatment Guidelines in preparation for the next edition. He is an assessor of foreign-trained urologists for the Ghana Medical and Dental Council. Professor Kyei considered himself a clinician and a trainer while bringing in research to enhance the clinical delivery and outcomes and communicating same to the world. In Accra, his clinical work can be assessed at the Kolebu Teaching Hospital, where he is the chairman of the kidney transplant team, having led the team in recent times to perform kidney transplants. Other hospitals he has offered consultancy services include the Trust Specialist Hospital, 37 Military Hospital, Police Hospital, Nyaho Medical Center, Leicester Hospital, the Tema Maritime Hospital, and the Bank Hospital, as well as other regional hospitals across the country. He's literally been everywhere. Professor Kyei is a member of the Société Internationale d'Urologie and a member of the Pan-African Urological Association. He is also a fellow of the West African College of Surgeons and the Ghana College of Physicians and Surgeons. He is a founding director and treasurer of the Ghana Association of Urological Surgeons, a founding director and member, Ghana Transplant Society, and the Ghana Palliative Care Society. He is also a member of the Ghana Medical Association and the Christian Medical and Dental Fellowship of Ghana. Reverend Professor Mathew Yamoah Kyei was baptized a Christian in 1983. Since then, he has held to his faith in the Lord Jesus Christ. He was ordained and gazetted as a Reverend Minister in 2019, and he is currently the head pastor of Kolebu Community Chapel, an interdenominational church in Kolebu. Professor Mathew Yamoah Kyei was born in Sunyani. He is married to Josephine Mpoma Kyei, a senior lecturer at the School of Nursing and Midwifery of the University of Ghana. They have 3 children, namely Mamiajua Usua Kyei, Pa Kodua Kyei, and Nana Bamfo Kyei. He enjoys driving and drama. Distinguished ladies and gentlemen, I hope you are as curious as I am to be informed and educated by the lecture titled Naked but Not Ashamed, Revealing for Good Outcomes in the Management of Genitourinary Disorders. Enjoy it. Thank you.
Prof, I've composed a very nice song for you. I hope you will enjoy it. Seprewa na mibwe. Seprewa is made up of the 3 Akan words. Se literally means speak. Pre, touch. Wa, small. Small touch, speak. This instrument speaks, this small instrument speaks when it is touched. Was discovered around 1600. Disappeared when guitar was introduced. 1964, my grandfather had a dream and rediscovered it. Taught me how to play. Nti yenya yediem. Ma yenwum bia ma Prof. Ago nana mo ntira nkonwa. Mama trans. Adadamu. Akuno ni ani ntira mo hyiam we. Mo akwa ba o. Ye be manyankopon ansa aboya ho banyama techama da bodwem wudi momo na ye yenka yenyine ni mo yenim adugudi enti ayawa Mamani anyamfo bintini ya wao Sabe me ya miken Sifia samai Awanu ofire Abembare kase Club ya sante kwa tokodishe Kwame Untini ya wa Ama mama dina nso eno baby awo bia onyame nhira wo Gana bedo wase wakumusura mama nsanwe bi e baba ko awobo no ne ho aba fa so amawi asa wawanne Prof o papa nso nyame nhira no abusia wodemu Namwase ani awopa Sabe me ya mekana semi ediya ya defra no wabemfo Mathew Kwame Yamoah Kyei Mama nae Untini wa adwuma pa wo ya Entini de wa be pia yi Sede ye ne da no asuapon sampase bebu obi ana ya mano so a ana ya de professor edi no beto so a agesa wo ya abadwam nkasa ya ansa wakwa Ebeneza Shadi ya midu wa bediro Kwame Ama moni yo Moni kuo mo Money adwuma pa. Money nkwadene. Me wi dem firi wo yire nso. Oba pe. Nana monim. Ensuo. Ana ma adwene ya hantan. Abasoba na meja paye. Oba pa. Money ko. Money yo. Kwame mawie me nsebre. Me di sepre wa frefro. Sanya nkonto frensia no patutu. Kwame ato apoma e. Ote anankanro. Ebi asiti ya o. Akuni ne ni ntanahia. Ma omuswe. Kwame. Abranu aso yasra wa kasa. Abranu aso. O wende kasa o kasa. Kwame me fla wo sanya nkonto frensia no patutu. Abranu aso kasa o.
Madam VC of University of Lagos visiting us, and our own VC, University of Ghana, this great university. Grateful for taking time off to be here and also to say these kind words about me. Thank you, Prof VC, and all my colleagues that are here. I'm quite overwhelmed from all the schools, School of Nursing, Dentistry, Nutrition, Pharmacology, and my own school, University of Ghana Medical School. Thank you all for coming to support me at this point, in time. I've also seen my teachers here. I've seen my previous provost, retired. I'll keep mentioning their name as we go on. Thank you all for coming, and I thank you for the opportunity to be here. They're on their shoulders. That's how far we have come, and we give God the praise. Thank you for Nananum who are here also. God bless you for coming in to support your son. Thank you so much. A few Reverend ministers are also here, the Reverend Professors, the Reverend Doctors. Please, you are all welcome. And God bless you all for coming. Naked but not ashamed, revealing the real and the common for good outcomes in the management of genitourinary disorders. I've been told that genitourinary is too big a word, and so I promise not to use it anymore. When I say genitourinary, we are talking about the genitals and the urinary system. We've got the kidneys, we have got a tube that connects us, the kidney, to the bladder, what we call the ureter. We've got the urinary bladder and the urethra. Of course, the genitals, we all know, the penis, the scrotum, the vagina, and other structures there. And so this is the words I'll use, and so, Madam VC, I'll drop genitourinary for now. I was also told that I must be careful not to preach a sermon. The truth is that naked, Genesis 2:25, is naked and not ashamed from innocence. But this topic is naked but not ashamed. The consequences are known, the implications are known, but for good outcomes, the clients, patients are willing to risk it, in quotes, so that they can get a good outcome in their management. And the last thing, Ananuma here, they warned me never to use any local language in mentioning any of the structures. And so Ananuma, I've taken your advice, so I'll keep strictly to the English language. And thank you, Ananana Wangit, again for coming. This is how you're going to look at it. We've gone through them already. A few discussions here and there on the difficulties in exposing oneself. The various things we have seen over the period in our management of diseases and in discussions. I'll pick a few of them as time will allow, and then we'll make a few points, acknowledging a few people and paying tribute to a few more people. Indeed, one of the most difficult things is to get a patient or a client to expose the genitals or the urinary system. And this is because people are shy, people have been trained to cover themselves. And as was said, with time, cultural reinforcement makes sure that it's very difficult to undress in public. Indeed, one time a patient came to the clinic, sat down, and there was a chaperone who is a nurse, a lady nurse. So I asked the gentleman, please, what brings you to us? And he said in a kind language, Mintumikra. So I said, oh, you'll be fine. I asked again, what brings you to clinic? And he says again, Mintumikra. Then it dawned on me that the company were not acceptable. So I asked our lady nurse to excuse. And then he said, Doctor, Mami Mio. In other words, he wanted some privacy to be able to expose himself. But the reality is that unless we are bold enough to expose ourselves in genitourinary surgery, the outcomes may not be that good. So here am I trying to bring attention to the importance of making or exposing ourselves for conditions that are worrying us in the genital system. The sooner, the better. I also mentioned a few of the things that with my colleagues we have uncovered in research and also in following up patients. And as I said, there are few people and institutions we will acknowledge within the time given us. A question that students always ask me, a lot of them are here, and thank you for coming, medical school. Why did you decide to become a urologist? In my profile, it was made that I had a scholarship to go to Imperial College, Westminster Hospital for medical electives in my 5th year medical school. I had wanted to be a pathologist. And so I had written for pathology. And a week to the time I would have left for UK, a mail came and said that, we are sorry, pathology is full. But we realized that there's a slot in urology. So if you are okay with it, you must come. And I've told the whole family I'm going to Abrochiri. So I went. But the interesting thing I found in the divine God's plan of providing urology was that, first was that I encountered very great people in the UK. For within a week, I had met almost every important person in the UK because of the hospital I were and because of the specialty. And the interesting thing is that they were always full of smiles for the services that they have received. And that encouraged me very much. So when we came back, I decided that I'll be a urologist. Another thing that struck me was the neatness and the technological advancement that the urology enjoyed in the UK then. We are talking about 1996. I saw gadgets that I'd never seen before. And I told myself that I must be in this specialty so that with time, with support with others, we'll contribute and make urology also as technological as possible. It was so clean that the urology unit was next to cardiothoracic unit. And my first 3 days, I was using the fluids that came out of the tubes that patient has to navigate my way to my urology. And in the UK at that time, there were people who had a lot of diseases that involved the lungs. And so they had tubes there that drain urine like blood, like the urology. So anytime I missed my way, I ended myself at the cardiothoracic center. I said, wow, you could put urology by cardiothoracic. That is excellent. Because way back then, it wasn't like that. I can see Professor Boatin here, and I'm sure he has been the urology unit then, and he can understand whether he will have put cardiothoracic by GU then. But we thank God that now we can do that. And the students come for lectures and they are taking their foods in the urology world, something you can never dream of. International exposure I also had, and I thank all those who worked to make it possible, influencing the wide range of services that we have. So I now dovetail to the discussions. Exposure and revealing is extremely important. What you see here is a gentleman we saw a few weeks ago. He has got these lesions appearing on the scrotum, and the lesions are 20 years old. He is 52. For 20 years, he has covered these lesions all along. And before I proceed, I must take caution from what VC told me. Please, viewer discretion is advised. Extremely advised. But we will expose so that we can all get good outcomes. After 20 years, something that was little had become a cancer, and we are struggling to be able to do that. When you put these findings together and we work on them and publish them and the outcomes, it helps us to do much better so far as our patients are concerned. So we say that please, it's important that we expose these conditions early enough so that a little cut here and there will solve it, a little medication will be able to solve it. Don't wait that long. What I showed you was 20 years. This one was 7 years. And I must say that I've got permission from all these people whose pictures I'm showing. So the pictures are actually selfies. Some of you think selfies is only taking your face picture. There are opportunities to take some other structures to be able to help us. 7 years, we were able to take it out. But unfortunately, it turned out to be a cancer, and he needed further medications and injections to help me recover. Yes, a good surgery was done, but he needed some medications. If he had exposed earlier, probably that wouldn't have been the case. But there are good stories of people who are exposed. This gentleman's story is 7 days. Had a small scratch on the scrotum, and they realized that it was spreading. Within a week, he reported. We started him some antibiotics, and then there was an improvement. And indeed, I took this picture. It has almost healed within a matter of 2-3 weeks, and I had to forward this picture to him. Revealing early had been of benefit to him. What would have happened if he had delayed? These are some of the possible outcomes should he have delayed. It would have eaten up everything. And even though our plastic surgeons and other colleagues would have helped to cover up, it may not have worked as efficiently as one would have loved it to work. I want to recognize Nia Bokobi, who just walked in. New Mohanu, welcome. Thank you very much. So reveal early, and we can get the outcome. If you don't, then it can be quite terrible. We call this a 4 years gangrene, and in most case reports, about 50% of such people do not survive if they get it into the blood stream. So the lesson is that please reveal early, and your urologist, the urinary surgeon, or the doctor that deal with the genitals and the urinary system can be able to help you and help you quickly. Another disease we have to contend with is prostate, the enlargement of the prostate. It is one disease that we encourage men also to share with us and reveal for us to see. Normally, the one which is not a cancer can prevent the urine from flowing. And this gentleman came with inability to pass urine, and his bladder was quite full. When we passed a tube to drain it, we had about 2.5 liters of urine. And of course, there was evidence that the kidneys were being damaged as well. When it became complicated, our management in training and before was to do an open surgery. And you needed about 3 units of blood to do this surgery. What we had been told then was that the prostate of the average African was very big. And so we needed to do an open surgery and bloody one like I've shown so that we can be able to get it out. Even though there were opportunities to have what we call minimally invasive methods, where we can put a tube through the urethra and by chips get the prostate mound out so you can urinate. The motivation to get these machines were very low on that premise. We set out to confirm whether really our prostates were big. And Madam VC, after taking a few patients and measuring their prostate before surgery and after surgery, we realized that almost 70% of our prostates were small enough to deploy these machines to do the surgery. And so currently, we deploy these machines to do the surgery. We want to acknowledge Kolebu for investing into these machines and other hospitals. We've got the Bank Hospital here, the Trust Hospital here, and various regional hospitals who have acquired these machines, allowing us to be able to do this surgery without the need for opening. In fact, my last check, that about 55% of all the surgeries for benign prostate hyperplasia in Kolebu is done by this method. I'm happy to say that should you need this kind of a surgery because of urinary problem or its complications, you are likely to get a transurethral resection of the prostate. I've looked through the literature. Previously, most African literature would say that the African prostates are big, but now we have stopped saying that. All we say is that we don't have the machines or the resources to acquire the machines. Because the idea that African prostate is big, definitely, for these purposes and the use of this machine, it doesn't hold true. So we're able to get these machines on. But one of the challenges, if somebody needed an open surgery, was for us to organize blood for this surgery. And in fact, you needed about 3 units of blood before you'd be allowed to send a patient to theater. So we went out to find out whether really we needed to make use of this blood. We decided to find out the reasons why we transfused these patients. And at the end of the study, we realized that if the person's blood level was normal, HB of 13, that person never received blood for this surgery. And we realized that not many require that kind of transfusion. So across the country now, most people will ask for what we call group and save. Yes, the blood must be available in the blood bank so that when we need it, then we can go for it. And sometimes we take our time to improve the blood level, and that worked very fine. We also learned from this study that if you do this surgery quicker, probably you may not need blood. And so now, most of my people or our people, colleagues, will do this surgery under an hour. And with that, most of the time, we don't need blood at all. So with just 3 units of blood in our institutes and our facilities, we're able to operate on many of these patients using the same blood as a bank or as a support for these surgeries to be done. We have embraced technology and we have been able to change our practice with some of these studies that we have done. If you tell somebody that I'm going to push a needle through your genitals, a very sensitive part of our organs, the impression is, this is going to be painful. And so we got people running away from important procedures that they needed. One of the common procedures we do is what we call the prostate biopsy. As you can see, we rarely have to expose our men to do this procedure, but it's important. We went out to find out whether the pain was as serious as we feared. At the end of the study, we realized that the pain scores were very low. The highest pain one has ever had was a 10, and no pain at all was a 0. Most of the men had a score of a 1 or a 2. We gave a local anesthesia for the procedure, and after that, there was no need for painkillers at all. In fact, what we do is that we give paracetamol, and most of them will tell them that they've got some at home, and they don't need any pain relief at all. So now we can reassure the men that this procedure is virtually pain-free, and many more men have allowed us to do this biopsy, which is important when it comes to diagnosing prostate cancer. However, for major surgeries, pain relief is important. And I must pay tribute to some of my anesthetists that we have worked with over the years. Dr. Francis Ahiaku, I know he's around. We have worked with Dr. Divine Kwame. We've talked about Dr. Robert Joblate, Dr. Mrs. Audrey Arnaud, Dr. Fari, and currently Dr. Vanderpoy. All these people have contributed so much to our work. And I think I stand here to share this work that we have all contributed as anesthetist for the procedures that we have done over the period. They can put what they call epidurals and things that make pain very, very useful. But you realize that sometimes because of complications associated with these pain medications, some men are not able to get that relief. So we have to come back to the cultural norm, which says that berima ensu. And it does work wonders. You only have to get a few nurses around and you realize that a berima ensu ampa. But as much as possible, we try to give some pain relief. Then the almighty infection. That we have also been able to deal with it. We feared it, but now with just an iodine in the preparations that we use for these procedures and modifying the antibiotics that we use, we are able to do these procedures without the need, to be feared of any infection at all. In fact, the last work that we did, we realized that infection is almost non-existent for this procedure. So, Madam VC, now we can confidently do this procedure for everybody, a prostate biopsy or any other procedure that we need to do for patients, knowing the antibiotic that works and confident that we are able to pull the patients through. Then the almighty PSA. We are talking about prostate cancer. PSA, we refer to it as the prostate-specific antigen. It is a chemical that when the prostate is in difficulty, it pours into the blood. The prostate is an organ important for fertility in men and is below the urinary bladder. And as one gets older, diseases may arise from it. Indeed, we need that PSA to help us identify people who may be at risk of getting prostate cancer so that we can be able to do what we call a biopsy and identify them and manage them. But sometimes it becomes like a big stick that the men are whipped by. Your PSA, come and do your PSA and your PSA and your PSA. Indeed, for some men, it is crucial that we do the PSA. The normal range is from 0 to 4. But per our work around Ghana here, it ranges from less than 0.02 for those who had curative surgery to the highest I saw a few weeks ago, 28,761.19. It can be as high. So we put the PSA test in context. And so how do we put it in context? We look at the range and the chances that we might pick some cancer. In a work that we did in 2006, 2007, if your PSA is between 4 and 10, the chances that you find a cancer was about 12%. What it means that if we diligently analyze about 100 people, we may have 12 of them having a cancer. The conference means that about 88 to 90% of them did not have any cancer at all. A current study that we have done, led by Prof. J. Mensah, has also found out that probably with our diligence now, new technology, new pathological analysis, with other stainings, we may get as much as 21%. But the important thing to take note is that when your PSA is between 4 and 10, the majority are safe. Between 80 to 90%, there's no cause for alarm. So please do not be in a rush. Take your time, approach, get a referral, get one of the specialists in this area, and they will take time for you. I've seen a man who had a PSA of 4.5 and had to cancel every flight and every engagement because his PSA was 4.8. I examined him and I realized that everything was quite cool. I asked him to go on his travels, perform penile duties, and come back for assessment. He did all of these. He came for assessment. We had a biopsy, and your guess is as good as mine. He was on one of the majority. There was no cancer at all. But if the PSA gets higher, then the risk becomes quite high. So we want you still to check your PSA. It's a blood test run by most laboratories around us. If your PSA is between 4 and 10, that is good news. But if your PSA gets above 20, then it's getting pretty difficult. Almost half of the time, we might get a cancer in there. And a work done by one of our residents showed that if your PSA is 400 or more, then your disease has spread. And so cure may be a challenge. So we advise that please do the PSA every 2 years, after 50 years. It's a good idea. And based on the figures, we'll be able to deal with it. If you do it early, you may not need to rush, looking for difficulty or trying to solve a problem. You can take your time, pick your periods that's comfortable for you to see your urologist, and then we can get a further assessment. And please ask the urologist whether he's praying, because sometimes we do the biopsy, and when you come, we pray that when you open it up, it is not a cancer. Pray that your report that you're waiting for will be good. But it's as if I've started preaching. So based on this work that we have done, please do your test and take note of that. Somebody asked me when I was exhibiting my the exhibition of scholarly work, that what about surgery for prostate cancer? I'll say it briefly. That surgery for prostate cancer, what we call radical prostatectomy, is very effective, and it cures prostate cancer effectively. In fact, if you are younger than 65, probably that would be your first choice to consider. Yes, we agree that it is an invasive procedure. The first 6 months, 1 year may be challenging, but you get your life back completely. And even if there are challenges after the surgery, so far as cancer control is concerned, we can still give radiation and you will do well. I'm happy to report that before this lecture, I tried to get in touch with many of the people we have had this surgery for, and almost most of them were alive. Many years down the line, 15 years, 14 years, and a few of them, as much as 18 years, were all alive and kicking. It is effective, it is durable, and it's something that is worth considering. I agree that there are a few complications. Issues about erection, issues about urine control. But in our last work, we realized that the majority of people is just maybe 7 or 8 out of 10 that they have such a challenge. And those challenges can even still be managed and be managed effectively. So it is a possible option for you if you are younger. If you are 45, 55, and 60, and you want to live to 88 or 90, I would suggest that probably you should consider surgery as your first option. So the message is clear. Please, after 50 years, check your blood level with a PSA. Every 2 years is fine. If your doctor realizes that your levels are approaching what is critical, we may ask you to do it yearly. Don't wait till your level is 400 or beyond. Then that could be bad news. As I said, for the friend with 4.5, 4.8, he could take his time and choose the period for further assessment. We will not talk about screening for prostate cancer without having a word on kidney cancer. For the work we do, the kidney is one of the organs that we have to deal with. Kidney cancer is the third cancer that we encounter. The first is prostate cancer, the second is a urinary bladder cancer, and the third is the kidney cancer. Sadly, we continue to see women that come to us with kidney cancer. The first picture shows a pregnant woman, almost 7.5 months. And what you see on top is a big kidney tumor. This lady has got antenatal from 14 weeks or 3.5 months. And scans have been done severally. But the scans never looked at the kidneys. By the time we saw, because he was pain, it was difficult. In fact, it was a bad omen that we had to deal with. The other picture you see is another person delivered after 6 weeks, blood in the urine, And then we saw that he's got a kidney cancer as well. The cancer has crossed what we call the midline to the other side. That was also a bad story. But for 9 months, she had had multiple scans assessing the baby. The kidney was just next door, but nobody stretched out to look at the kidney. We will encourage that please, as a policy, antenatal scans should at least once in that period go a step further to look at the kidney. And for prostate check, probably we should add the kidneys to it. If we do, then we are likely to get these kidney cancers in an early stage, which are essentially curable. Because the smaller the cancer, the more likely that it's likely to cure. We must admit that with the increase in this imaging, the CT scan, the MRIs, and the ultrasounds, our kidney cancers are becoming smaller and smaller. They used to be averagely 16 centimeters. Now they are small, 11 centimeters. But we need about 7 centimeters or less so that we can be able to effectively cure our people. So should we add these as part of the policy in antenatal care and prostate check, that we may succeed in reducing the size a bit more and getting a cure for our patients. We talk about the kidney stones. One of my residents said, please talk about kidney stones, because it has become a very common disease that we have to deal with in recent times. We checked from January to now, we have operated on about 52 to 60 people with stones in the kidney, stones in the tube that connects the kidney to the bladder, and stones in the bladder. But I'm happy to say that with the help of the facilities around, we have got technologically advanced means of dealing with these stones without having to cut you. Stones in the kidney can be broken without cutting you, what we call the shock wave. We can take machines down there with laser and break them, as you can see in the next photo there. But we still continue to find stones in other areas, sometimes quite perplexing. The left is a bladder stone, multiple, as if somebody has really poured stones into the urinary bladder. And there is a young lady who presented with pain on passing urine. He has seen a few doctors within a 2-week, and everybody was treated for urinary tract infection and antibiotics. But this lady revealed, when he was asked us to look down to see what is happening, and we realized that a stone has dropped into the tube and was causing all her pain and discomfort. We were able to push it back, and she was able to urinate. So the question is, why is it that stone disease that used to be quite uncommon is now a commonplace? We analyzed our stones, led by one of our young people, Dr. Ivan Sapakli, and we realized that dehydration was the most common reason why we are forming many stones. Global warming may be a reason. It's not very warm around us. In fact, I checked, and I'm told that since 1880, the body's temperature, the temperature of the globe, has increased by about 1.5 degrees, which is quite significant for our world. But we all know about our galamsey and the difficulties of getting clean water to drink. Now we ration our waters because they are costly and very expensive. We want to pray that we can come to the point where we can all drink from the tap again without looking back. Drink enough and get some that you can even spew out when you move out from the tap. I'm sure when you all put our hands to the wheel, check on the galamsey and our water distraction, we may come to this point. When we reach this point, then probably we may get some respite from kidney disease. Indeed, kidney disease is one of the causes of kidney distraction and the dialysis and the kidney transplantations that we talk about. Then I will wrap it up by talking about what we have been looking at so far as the penis is concerned. So we have been working on revealing for good outcomes. We have talked about the importance of, prostate workup technology, blood saving, and also the PSA and the detection of cancers, and how we should look at it and should be our attitude. We have talked about the importance of water to prevent us from destroying our kidneys because of stone disease. If you indeed drink enough, so that we can 2 liters or more, or be able to urinate about 2 liters a day, then probably you will not form a stone at all. We say mind the whole, choose right, and hit right. The penis must be well oriented in looks and function. Again, I'll drop a disclaimer, but these are all pictures patients have provided for us. Definitely, these curved penises are not good enough for function. They cause pain and they cause challenges for the individual. If it gets to this point that is that much curved, then we have to do surgery to correct it and make it straight again. But the reality is that if you should find this early enough, then we can give medications that will reverse it. In fact, a lot of studies and there are a lot of patients that we just have to give vitamin E supplementation and the disease resolves and it returns back. How did these people get the disease? Sometimes little injury that they sustain causes it at time of intercourse. Sometimes it's because they genetically form what we call fibroids, or we call it fibrosis or big scars, and so they form this particular curvature of the penis. Surgery is able to correct it. But as I said, we wish that we can find it early, so we don't need to come this far. Indeed, this one patient after surgery took a picture and he sent it to me at 3 a.m. You can tell that he was quite excited. And sometimes you see these pictures and then you are jealous. Choose right. Sometimes people masturbate and they have mishaps. They drop it in various places and they push various things around it. This was a strange finding for us. A gentleman put an engine block ring around the penis. The reality is that unlike masturbation, this man, doing professional exams, and according to him, the spouse was disturbing him with advances. And so to stop the spouse's advances, he decided to put this on. And then it got stuck. How to get this was a challenge. So we had to consult the engineering department of our hospital. And we had to get a rotator machine to be able to get it done. We cooled it, and to our dismay, after the first cut, we couldn't remove it. So we had to do 2 cuts before we can take it off. By the time we were done, it was dangling in our hands, and we were really scared. But strangely, after about 8 months to a year, the penis bounced back. He developed a hole in where the urine passes, but the erection material and mechanism was intact. We wrote on it and told the world that, please, the machine erectile tissue is resistant to heat and burning. So when he has such a challenge, focus on protecting the urethra, the tube down there. Minimal protection of the tissues for erection may be enough. And after us, a lot of people have reported it and cited it severally, that indeed the penis can withstand heat. So anytime you hear about some California fires, don't worry at all. They are safe. Very, very, very safe. The final point, we are saying that hit right. This is missing your way and hitting some places, and then the penis breaks down. Bra. We require surgery to fix it up. Previously, it was thought that leave them alone and let them heal. But I realized that when that happens, erection becomes a challenge. So what you see is somebody who came with such a challenge. We took the person to theater as emergency, and we saw a rent down there. This was successfully repaired. And just after surgery, you can tell that there was hope. for the structure. And so emergency surgery is very, very helpful. So we are saying that, yes, let's have our enjoyment, but we must be a bit careful. But should something go wrong, be assured that our colleagues are here to support you and we can be able to deal with it effectively. Wrapping up, I will say that urology has gone through a lot of challenges over the years. When we were in training, there were just about 11, including trainers in the country. But with a lot of work, now many more are being trained and graduated. Professor Yidi Yaboah Kyei and myself were among those who started what we call the Ghana Association of Urological Surgeons, and the current president is Professor J.E. Mensah. At our last check, in collaboration with other stakeholders and training urologists, we now have 66 urologists in the country, from about 11 in 2005. Indeed, teamwork and collaborative efforts can achieve much. And so, what I've talked about this evening, almost every part in the country, there are people who are qualified and experienced to handle these issues that I've talked about. It has been a decade of clinical experience and research to improve clinical outcomes for people with diseases involving the genitourinary system. As I said, we have trained people, and many more people have been skilled to do that. We have also told the world our peculiarities and bring out some of the things that need to be considered in managing these cases. And the world has acknowledged some of our work, and they continue to partner with us in unraveling more and more of the things that we encounter. This inaugural lecture, I've been on observations, some of the care plans, follow-ups over years, some of the research findings, and all these have been directed to improve the outcomes in the management of genitourinary disease in the country. The message is that, please, let's review so that we can get good outcomes in the management of our genitourinary diseases. Naked, yes, but no shame. I want to thank God for His grace that has brought me this far. Indeed, from very, very humble beginnings, and the Lord has brought me this far, and I thank Him for all the opportunities that He brought my way. I've got teachers, mentors who have held my hand. I can see Reverend Professor Aite, who has been quite a great help along the line. And God, thank all of you for bringing me and helping me out this far. I also want to special tribute to the College of Health Sciences, which is celebrating their 25th anniversary now. I can see some of the past provosts are here, some of the administrators are here, and of course I can see some of my own dean and HODs are all here. 2000, some of us in the residency program were offered scholarships solicited by the school that allow us to stay back in the country and get skilled and offer services to the nation. And so we say, Ayiko, your work that you did 25 years ago and beyond has borne fruits for the benefit of the whole country. Kolebu is 100 years, and strangely, some of us can say that for almost 30 years, we've also contributed to the 100 years of Kolebu's existence. We thank God for that opportunity. The late Professor Yaboah took me as a personal friend, son, mentor, name it. As my boy would say, manager. And he has put so much to make sure that I'll get all the international exposures, local training, and of course, the needed integrity for the work that I do. And so on this occasion, I want to say tribute. Unfortunately, Mrs. Margaret Yaboah was not able to be with us because of one challenge, but she is with us, and graciously, a book that we all contributed for Prof. Yaboah to work on has been made available for us as a gift by courtesy of the family. So Auntie Maggie, God bless you so much for all the support over the years. took this picture 2009, and these are some of our teachers who helped us through. The late Prof. Dr. Krufio, Mr. Samuel Jepiati, who is not able to be with us. Prof. Mensah, I've acknowledged a colleague, a senior colleague. We have worked together in a lot of work together, taught through, and be able to accomplish so much in bringing urology this far. Residents are here. Some we have trained. Prof. Yamba, yours, and others have all been very, very helpful in helping us get data and be able to follow our patients along the line. So for all the residents and trainers that are here, young consultants, thank you all for coming this evening. I've acknowledged my teachers. Prof. Kelamte has been a personal mentor and a friend, and everywhere I've been, including my wedding day, he was there to support the wife to cut our cake. And so thanks so much for working with us all these years. God bless you and Mommy for being with us all this year. From Mathew, just past HOD, very, very good friend and a support. And my headmaster who saw me on the corridor and said that you must give an inaugural lecture. And here am I, if an inaugural lecture. Thank you, headmaster. But I'm still trying to resign for your class. My students are here in their numbers. Thank you for coming. God bless you so much. Opportunity to interact with them and the questions that they ask has all contributed to the successes of the work that we do. And there are a few facilities that I've had the privilege of helping get their urology sessions going on and bailing out. And some of them have been able to get a lot of these technological advanced systems available. Of course, we talk about Kolebu Teaching Hospital, we talk about the Trust Specialist Hospital, they are all here, the Bank Hospital, and the Leicester Hospital. And many more regional hospitals have all counted on us to help guide them acquiring these machines and technology for their services. Thank you all for investing so much to make urological practice better for the country. As Asikafu are here, Obuasi Secondary Technical High School. We say heads and hands collaborate. And I've enjoyed urology because I ended some technology or technical skills and science. And I do repair my own machines sometimes because of this exposure. So STEM started long ago. It is not a new creation at all. And some of us were privileged to be in a STEM school in 1983. And we still continue to enjoy that. The other years are also here. Opportunity we're given, exposure is given, and support. Or that year for life. Thank you all for being here to support us through it all. To our special guests that are here, some of you, all we did was to drop you a card, and then you are here. And I say thank you all for coming. A lot of our church members are here, Kolebu Community Chapel, the spiritual support that we have, people from LIC, thank you all for coming. It has been a great collaboration, letting us know that the spiritual issues are equally important in our work. My late mom, Mary Arinche, wherever you are, may the Lord continue to keep you in the bosom. But my daddy, Mr. Kwame, is on the line in Kumasi. He was not able to make it here, but she tells me that they have set it out for him so he can be able to work. So, Dad, here is your son. My extended family are here. Some of you, as the scientists will say, are sitting on the lap of my daddy to be here. Thank you very much for being here to support us through. And then the lady of the house. Dr. Mrs. Josephine Pomache, School of Nursing. In fact, they told me that all my wives are here. And rivals, they are all here. Thank you so much for coming to support us. I don't know how she does it, but she's the center of gravity of the house. I mean, how she does it, I don't know. I call her housewife. And yet, doctoral student, doctoral, postdoctoral housewife. I don't know how she does it. But thank you so much for supporting the family. But Abisi, I want to tender this in for UG Day, part of the competition. So it has been tendered in. The whole family is a UG. wearing UG Day to celebrate our 75th anniversary. Mami Owusu Ache is here. Paoko Ache is here. Nana Bafuche, they are all here. But Davisi, these are all scholarly works by themselves. And we thank God for their lives. Great support, great spiritual support, great emotional support. But there have been sad moments. And I want to pay special tribute to 3 of our teachers, 2 teachers and a colleague who were involved in a ghastly road traffic accident after an outrage to Sunyani. And dying on the spot. At that point in time, we were reduced to, 11 was reduced to 8 just by an accident. And since then, some of us had to carry a huge burden of carrying our urological services to support the country. Prof. J.M. Korte, Dr. Sevi Afi was my colleague then, and Dr. Isaac Benson. May the Lord keep you in his bosom. And thank you all for the services that you had. Your training is what has been able to get generations of urologists trained. But when I decided to give this inaugural lecture, even thinking about it, tragedy struck us again. My own Professor George Klufie, who reviewed every single paper that left our department, passed on. And Emmanuel Kweku, who wrote a few papers together, worked together at UGMC, also passed on. It's really been a tough time this year for us in the urological fraternity. I pray that God will continue to protect us. Inaugural lectures are destined to be given once. Scripture tells us in 2 Corinthians 5:10, for we must all appear before the judgment seat of Christ, that each one may receive the things done in the body according to what he has done, whether good or bad. That is inaugural lecture. But I count myself a few privileged who are going to give it twice. So today I'm here giving the first one, privileged one, by the help of my own university, a very privileged one. I trust that you have judged me well. Madam VC, our visiting VC from Nigeria, my teachers, mentors, reverend ministers who are here to support me, old friends over the years, schoolmates, students, both postgraduate and undergraduate level and residents, new men, non-men, wonderful friends who have stood in for my own chiefs who are far away in Barikese. I'm grateful to you. External family that have come from Kumasi and long distances, Mampong and everywhere, God bless you all for coming. Ladies and gentlemen, I'm available for consultations. But one thing is sure, naked you will be. But no need for shame. It is all for good outcomes. Thank you very much.
Our lecturer deserves a standing ovation, please. Let's give him a standing ovation. And keep clapping for him. Thank you very much. Please resume your seats. Prof. Kyei, our distinguished lecturer, thanks very much for this thorough expose into our urinary system. I chose the simple one. I didn't go genital urinary. Thank you very much. You've given us a lot of insights into our urinary system and more, and we are very grateful. This sets the tone for the impactful research that we all hunger after. Thank you very much. Let's give him another round of applause. It's now time to relax and take a performance from the Ghana Dance Ensemble. The Ghana Dance Ensemble performs the Sanga dance, and this is the message they have for us. This is a naughty and humorous dance that was popular in Ashanti region in the early 1900s. The drums and rhythmic patterns suggest northern Ghanaian origins. This dance has embraced elements from two distinct ethnic groups. In this dance, the women perform to court the attention of their gallant men. The men in turn respond in an equal measure, and this sets the tone for mutual engagement. This dance has been selected to reflect the ethnic lineage of our distinguished lecturer. Secondly, the dance fits into the lecturer's surgical discipline, where delicate movements, like delicate genitourinary parts, are carefully cut and sutured to reveal an aesthetically pleasing and healthy human body. Distinguished ladies and gentlemen, the Sanga dance by the Ghana Dance Ensemble. Let's appreciate the Ghana Dance Ensemble. Thank you very much. Thank you for the performance. Madam Chair and Vice Chancellor, distinguished ladies and gentlemen, our distinguished lecturer has extensively acknowledged all of us for being present here. But please permit me to single out a few of our guests to acknowledge. We are privileged to be joined by a former Vice Chancellor, Emeritus Professor Clifford Niboy Tego. We also have some former provosts of the College of Health Sciences here with us. We have Professor Aaron Lantile Lawson, and we have Reverend Professor Seth Ayete. Reverend Professor Patrick Ayekumi, is he here? We are also privileged to have been joined by Professor Kwabena Frimpong Boateng, President of the Ghana Heart Foundation and former CEO of Kolebu Teaching Hospital. And we also have a former Director of our Human Resource and Organizational Development Directorate here, Professor Mr. Daniel Obedu. We have a lot of Reverend Ministers here. As you know, our distinguished professor is a Reverend Minister, and he has duly acknowledged them. So let me turn to the traditional rulers. Let me acknowledge now Professor Edmond Dele, Paramount Chief of Nandom Traditional Area and founder of Rabito Clinic Limited. Our distinguished professor also duly acknowledged Ni Abokobi. Thank you very much. We also have Nana Kwejo Ahenkra Ayum IV from Akim Ejafo, as well as Nana Ejenim from Akim Ejafo. Thank you very much. We'll see some more guests as we move on to the presentations. So let me now move on to the presentations. Our distinguished lecturer is the head of department of the Department of Surgery, located in the University of Ghana Medical School, which is also located at the College of Health Sciences. So I'm going to move from the college. I invite the College of Health Sciences to come up and do their presentation. College of Health Sciences. And the school, University of Ghana Medical School, should get ready together with the Department of Surgery. University of Ghana Medical School and Department of Surgery. While they are coming, the Ethics and Protocol Committee and Health Sciences Investigational Journal reps should get ready. The Ethics and Protocol Committee, Health Sciences Investigational Journal, while they are at it, Ghana Association of Urological Surgeons and Urology Units should get ready. Ghana Association of Urological Surgeons, and Urology Unit, please come up. The Trust Hospital and the Bank Hospital should get ready as well. The Trust Hospital and the Bank Hospital. The Trust Hospital, the Bank Hospital, please come on. Kolebu Community Chapel should get ready. Kolebu Community Chapel, please get ready. Kolebu Community Chapel. While UGMS class of 1997 gets ready. UGMS class of 1997, please get ready. UGMS class of 1997. The SICA4 should also get ready. All students of Obuasi Secondary Technical School, the SICA4, we expect you to mount the days with sacks of money. Other dears should get ready, PRESEC. All students of PRESEC should please get ready as well. Yes, Ikafor didn't come with the money. I believe that day will come with something interesting. For those of you who may be wondering, in those days, ladies could go to pre-sec in the sixth form. That's why you are seeing ladies and not gentlemen. Now I turn to the extended family. The extended family of Prof. Kyei, please mount the podium. And I invite our inaugural wife to get ready together with her children. I call her inaugural wife, the lady of the house, Dr. and Mrs. Josephine Kyei. Please get ready with your children. I've just been hinted that School of Nursing and Midwifery also has a presentation. School of Nursing and Midwifery. And that will be the last. Thank you very much to you all. We will now take the chairperson's closing remarks. And so please join me to welcome our chairperson and vice chancellor, Professor Nana Bapia Amfo, to deliver her closing remarks. And please pay attention to her. Thank you.
Thank you very much, Director, Public Affairs. And I would like to start my closing remarks by thanking Professor Mathew Kyei profoundly for a very revealing lecture. Yes, he deserves a round of applause. I have currently lost track of the number of inaugural lectures that I've had the privilege to chair as Vice Chancellor. I've chaired many of them, coming from various disciplines. And I've usually enjoyed it as people, break down their disciplines, connect their research with practical solutions. And I have not hesitated at all to share my takeaways at the end of the lecture. But this evening is quite different and special. I was warned that this is PG and could be graphic, but I think I wasn't warned enough, Professor Kyei. Professor Kyei, under the disguise of professional immunity, freely use words like scrotum, penises. I didn't know there were curved ones and straight ones. But unfortunately, I don't have that professional immunity. And so I will stay the straight and narrow path and share my lessons from this evening's lecture. The first one for me is the power of divine plan. Clearly, Prof started out with other plans, but indeed, it's obvious, Prof, that God had other plans for you. And we thank God that you availed yourselves, and we have seen how mightily He has used you to bless many male lives and by extension, families in this country and beyond. So for our young people here, it is great to plan, and by all means, you should plan. But you should be flexible and amenable to God's divine plan for you. We are grateful, particularly Prof. Kyei, that, starting with a team of, as you mentioned, 11 urologists, we can now count 66 scattered all over the country, providing the critical service that you spoke to us about. I was particularly interested in the gender numbers. I didn't hear that. Perhaps you can tell me that of record, how many female urologists we currently have in the country. The next lesson I learned was that exposure is not always a bad thing. Exposure as a word in itself out of context generally has a negative connotation. So we are exposed to certain things and we get certain repercussions. But this evening, he demonstrated to us the positive side of exposure. First of all, he talked about external exposure, the external exposures that he had, which has significantly influenced his life and his career. And also, even more importantly, that early exposure results in good outcomes when we are not ashamed and we expose when we have to in the appropriate spaces. The third lesson for me is the importance of research. As a university, our second strategic priority is impactful research. We have seen the research that he has done with his colleagues, and which has demystified certain misconceptions and perhaps knowledge handed down to us without critique. One of which is that African prostates are large and are not amenable to minimally invasive procedures. Thank you, Prof. Kyei, and your collaborators for exposing us to these truths through demonstrable research. The fourth, for me, is embracing technology for better patient outcomes. It reminds me of our own vision as a university to achieve global impact using innovative research, teaching and learning, doing all of this using technology-driven and people-centered approach. And I think the work that Prof. Kyei has done over the past 20-25 years clearly demonstrates that he has been technology-driven and he has been people-centered in his approach. Prof, we are grateful to you that you have been a good ambassador of the University of Ghana. And lastly, I would like to reiterate the advice that he gave to all the men. First, he says you should do your PSAs. Please remember to do that. He also indicated that we should be mindful of the whole and hit right. Now, my personal advice to you men: don't ignore the advances of your spouse. Because when you do, if you are lucky, you will land in an engineering department. But if you are not, you might have to bring the fire service in. So let's not ignore the advances of our spouses. They are critically important in keeping us healthy. And so let's be unashamedly naked as we reveal early for good outcomes in the management of genitourinary disorders. Prof. Kyei, we are so grateful to you. On a lighter note, your provost was wondering whether I have given you permission to work in all the hospitals who came up here today. I said in that...
Let's appreciate our chairperson once more. She's given us a succinct summary of the lecture. That's why I asked you to listen to her carefully. Thank you very much, Madam Chairperson and Vice Chancellor. I'd also like to add my voice to appreciate you all. We thank you very much for heeding our call and for coming both physically and virtually to listen to our distinguished lecturer. I'm happy to inform you that we have been live on our campus radio, Radio Universe 105.7. And I announced earlier that we were also live on our social media platforms, especially YouTube. Now, our lecturer is going to grant an interview on Radio Universe 105.7. And that will be on Monday, 2nd June at 8:30 a.m. Here, you are not allowed to ask questions because we consider him an authority in his area. And so when one delivers an inaugural lecture, they are not asked questions. But we are kind enough to allow him answer your questions on Radio Universe. So we invite you all to tune in and ask your questions on Monday, 2nd June at 8:30 a.m. I am happy to announce that College of Health Sciences has displayed its beautiful 25th anniversary logo here on my right side. It's there for all of you to pose by it and take pictures and share on your social media platforms. The college is 25 years, and we must all join them to celebrate this very important hallmark. We have a number of upcoming events. If you turn to the back page, you see that we've put 2 of them there. Tomorrow at 8 a.m. here in this very hall, we are going to have our Techremapa Hackathon 2025. And this is an innovative challenge aimed at leveraging artificial intelligence for inclusive communication. Please join us tomorrow at 10 a.m. here to witness the innovative ideas that our students have to exhibit. We invite you all to join us. Our next inaugural lecture will be delivered on 12 June 2025 here in this very hall, and it will be delivered by Professor Samuel Ejeinsia from our Center for Horticultural Research in Kedi. And his topic is Being There, Done That, Unleashing the Potential of Soya Bean in Contributing to Poverty Reduction in Northern Ghana. We invite you to join us on 12 June here in this very hall, same time, 5 p.m. Please, we invite you all to come. I would like to announce that we ought to extend appreciation to our two colleagues who joined us from our Center for Disability Studies and Advocacy to do the sign language for us. We have standing by me Mr. Emmanuel Akwasi-Abuaje, and the lady is Mrs. Joyce Nyakwa Agbedaho. Thank you very much, colleagues. For our order of refreshments, we will have the students take their refreshments at the AA Kwapon Quadrangle, which is the forecourt of the Great Hall. And I invited guests, ladies and gentlemen, please let's rise for the university anthem, above of the brochure and also on the screens. Thank you very much for joining us. Please let's remain standing for the platform party to recess.